Hello and welcome to Fixing South Sudan, your ideas for building the new nation. I am Adingor. Hello and welcome to Fixing South Sudan, your ideas for building the new nation. I am Adingor. This week on Fixing South Sudan, a focus on public health. What does this mean? Is it a good idea for fixing South Sudan? And with us is Dr. Aluel William Nyuon, a veterinary doctor and the owner of Gatbang Veterinary Clinic. It's our pleasure to welcome her to Fixing South Sudan. Welcome to the show. How are you?
Good, thank you.
It's a pleasure to have you, and we are going to talk about a lot of issues, most prominently public health. It is something we have never discussed in this program, but it's of paramount importance. But before we delve into that, maybe let's get an idea about who you are. Maybe just introduce yourself and your credentials.
Thank you so much, Badingor. My name is Aluel William Nyuon, but I go by Dr. Aluel Ban. As you've already mentioned, I'm the owner and the veterinary doctor at Gatbang Veterinary Clinic. Before I went into veterinary medicine, I used to do human medicine. I was specialized in hepatology, that's diseases of the liver. And when I went to Malakal, I found actually most of the diseases of the liver there were from the environment, like liver flukes, from the water people drink, or from food that they eat that had fungus, aflatoxicosis. And learning about the environment made me more interested in animal diseases and how they affect human beings. So I went back to school and I did veterinary medicine, so now I am a full-time veterinary surgeon.
So now you own a clinic and it's focused on the pets. Tell us about your clinic.
Okay, my clinic is, most of my clients bring their pets, cats and dogs, but we have a lot of cattle as well. People who own cows in Juba, people who own sheep and goats. So we're a mixed practice, that's what we call it, a mixed practice.
And how is that going? If not the only one in South Sudan, probably the only one in Juba.
Well, I have heard it said. I think I'm maybe one of the very few who are specialized specifically in small animals. That's my area of expertise. That's what I practiced when I was in England, were small animals and horses. We don't have horses right now in South Sudan, so that's why I'm concentrating on small animals.
So how are you helping by having your clinic? What is the impact of it?
Well, I think a lot of the impact is actually teaching our people the role of animal health in human health. When people have sick animals, they don't think that they can get sick from those animals. So that's a teaching process, to teach our people that you need to treat your animals for your own health. And the other thing as well, one of the biggest problems I have, someone comes to me, stands outside the door and says, I want medicine for cow, I want medicine for sheep. There's nothing like that. We treat the entire animal. So we need to have the animal brought to the clinic. We can test, as you saw when you came to my clinic, we have stethoscopes, we have a small lab where we test the blood to know exactly what is wrong with the animal, so we can give them medicine specifically for that disease.
So the demand is for things that you are not, like the animals that are being brought by your clients are mostly the pets, but the demand to treat the cows.
Yes.
And you know that cows, they are in the millions. So that must be a challenge.
It is a challenge. It is a huge challenge that I personally cannot deal with on my own. That's something that we need the government to get in and the ministry to get in, because right now a lot of the gap is being filled by the FAOs, other NGOs as well. But sometimes we get people who are actually not veterinary doctors dealing with animals. Anyone can come with a syringe and inject an animal. But we need actual doctors, because a human doctor and animal doctor, they're actually equivalent. So we cannot leave because it's an animal, we allow anybody willy-nilly to treat animals. So we need investment in our animals.
So tell me about the inspiration behind your clinic. It must be one of a few, if not the only one in Juba, and most definitely the Republic of South Sudan. When did you start it, and what would you say about it?
The inspiration behind the name or the clinic itself?
The clinic itself, the theme, and why you focus particularly on animals.
Well, I think we all know that our country doesn't have the best in terms of public relations or the image out there. And when I was out there, all I kept hearing is there's no veterinary services in South Sudan. Sometimes people fly in veterinary doctors to come and treat an animal here in South Sudan. So that's one of the inspirations that got me to improve the image of our country by making sure that we have veterinary services in our country. So if someone wants to bring in their pet, they can bring it in. If they want to take it out of the country, it can be taken out as a healthy animal to be taken out of the country.
So who are your clients? Who are you catering?
Well, the majority of my clients are actually South Sudanese in terms of volume, but in terms of income, it's expatriates. I'm the veterinary surgeon for most of the embassies from the Western countries. They've recently been allowed to keep animals. Before then, I think they were not being allowed to keep. But right now, the American embassy, the Norwegian embassy, I look after all their animals.
Okay, and how is it going? As not just as a business, but as a service?
Well, as a service, I don't think many people know about it. And if they know about it, they have a huge complex. They think that veterinary medicine is very expensive. And because they think it's expensive and unaffordable, they wait until the very last to bring an animal who's almost dying to us. And sometimes they'll bring an animal and leave it at the door and go away. So we want to tell them that it is accessible to South Sudanese. You don't have to be very rich to come to our hospital. Some of the times I treat animals for free. If someone cannot afford it, I will treat an animal.
And can we maybe make sense of the fact that the mantra that animal health is also good human health? Can you tell us what is the meaning of that?
Well, the meaning of that is that healthy animals make for healthy human beings. Right now we are all hearing about Ebola, Ebola, Ebola. What we're not being told is that the animal domain is involved in Ebola. A lot of diseases that affect human beings, the most dangerous diseases, actually come from animals. And we live with animals, we eat animals, they're part of our lives. We cannot exist without animals. So there's no point living with things that you don't treat, because eventually you're going to get that disease. An example is leptospirosis. It's a disease that looks and presents like malaria. You might go to hospital with diarrhea and you have fever and you're told, well, you have malaria and typhoid. Maybe it is not malaria and typhoid, it could be leptospirosis. And even if you treat yourself, but you have the dog in the house that has not been vaccinated, you will still keep having it. If you don't deworm your animal, your children will always be having diarrhea all the time. But you only give one tablet to your dog or your cat, and that disease cycle has been broken.
You maybe give the dog or the pet owners general advice, because not only are the pets kept at home, but there are those who are roaming on the streets. Sometimes they are knocked down by the motorists. So how do we deal with that menace, if we can call it that?
Yes, it is a menace, and it's something that actually needs a lot of investment from everybody. That we need a long-term process, and no one will come from outside to deal with this problem. It is our problem. We need to have a small number of dogs on the streets to keep other dogs from coming in. But those dogs, they need to be sterilized so that they don't keep having puppies. That's one aspect to it. The other aspect is to make sure that there's no food being thrown on the streets, because if there's food, the dogs will multiply. The other thing is people who own dogs, when the female dog has many puppies, they just throw them on the street and they increase the number of roaming dogs. So we want people who own dogs to bring their dogs to be sterilized so that their dogs don't keep having babies, to be vaccinated, because the most dangerous disease in the world is rabies. If you're bitten by a dog that is rabid and you start showing signs, you're gone, 100% death rate. It's more dangerous than Ebola, it's dangerous than any other disease in the world.
And it's common.
It's very common. It's very common. Every time I hear a child has died, it's usually children, because they're the ones who are on the streets playing and the dogs bite them. Sometimes a dog can bite a goat, give the goat rabies, and you get bitten. You're a farmer, you get bitten. But if you're in Terkeka or Mundri or wherever, you're not going to come to Juba for treatment.
So who's supposed to do what? Is this just a public challenge, or are you directing it to a particular concerned department?
Well, I'm specifically talking about two specific ministries at the moment, the Ministry of Health and the Ministry of Livestock. The Ministry of Livestock is what is in charge of all the livestock animals, including dogs. And they should have a system in place for us veterinarians to enable us to deal with this problem. The other thing is the Ministry of Health to make sure that there is anti-rabies vaccines in all the hospitals. In case somebody is bitten, they can go and get those 5 injections that they need to get. But if we vaccinate 70% of all the dogs in Juba, rabies will be eradicated. We won't have it in the country.
Why don't we take a break from it?
Check the gums. There are 3 things that a dog needs. One is vaccination. It's rabies, it's the most dangerous disease in the world. It kills people as well. And 2, you need to wash it. It's to stop ticks that bite the skin and the ears. You see those terrible things that you see on the streets? You need to take 1 tablet, warming tablet. See, it's very good for dogs. They chew one so that they don't get any stomach conditions. Because those stomach conditions can affect your children, they can affect any older people in your house. So this is a painkiller for dogs.
Welcome back to Fixing South Sudan, your ideas for building the new nation. I am Adingor, and with us is Dr. Aluel William Nyuon, a veterinary doctor and the owner of the Gadbany Veterinary Clinic. It's our pleasure to talk about her idea for fixing South Sudan. Public health as a concentration. Can it fix South Sudan? And can public health fix South Sudan?
Yes, I think so. It can fix not just the economy, and apart from our health, the economy, we have the 5th largest herd of cattle or livestock in Africa. If we invested in that, we would get more income from livestock even than petrodollars. Countries like Namibia, they have livestock, and that's what making their economy to be very strong. So if we fix the livestock industry, it could actually help our own economy. If we fix the health of our animals, it will stop us getting infectious diseases and contagious diseases and all these people going to hospitals all the time because they're ill.
How do we approach that? We know the volume, the number of cattle in particular, are so many, and the animals. South Sudan is blessed with a lot of animals. So where do we even begin? What is your solution?
Well, the main thing is marketing. We need to sell our country, but we cannot market our country if there is no health service available. We need to show that we have disease-free zones, that our cattle will not take any diseases, because we may eat cattle that are full of disease, but we will not be able to sell them to other countries. So we need to make sure we have a healthy animal or livestock industry, and then we start marketing to other countries. For example, I know I went to Northern Bahr el Ghazal, that's where my mother is from, and the Arabs, they come and they import our cattle, take them back to the north, and then they sell it to Saudi Arabia and other countries at a premium. So why are we not investing in our own cattle and sell them at a premium for us as South Sudanese and get the income coming into our country rather than selling them for peanuts for somebody to go and sell for dollars outside the country?
Let's address the investment aspect of it. What are we talking about?
We're talking about setting up slaughterhouses. We're talking about having preventative care. All our animals, most of the time, they're sick from tick transmitted diseases. If we had healthcare that is available, have medicines in the country, have anti-tick medications in the country, have slaughterhouses so that we can show the people that our animals are being slaughtered in a very clean environment, then we can be able to export our animals out of the country. But we cannot do that if we don't have any abattoirs or slaughterhouses.
So would you talk about increasing money or putting a lot of money into the Ministry of Animal Resources and Livestock? Is that where we should be concentrating, or is it cross-cutting between agriculture, Ministry of Animal Resources, and even health for that?
I think it is cross-cutting, because you cannot have livestock without agriculture. In fact, they should be under one umbrella, because the livestock need food and agriculture is what will grow. If we were growing maize, then the product from maize that humans being don't eat is what is given to animals, and the animals grow fat. And then we can have a dairy industry from that. So this is cross-cutting, but we need people to sit down and decide that this is what we want to do. But we're not doing that at the moment.
What Uganda is doing at the moment is a bit comical, and they are doing registrations and even issuing birth certificates for animals, and it's something that is being laughed about. But is that a serious proposal?
It is a very serious proposal. This is what shows the world that we are serious. When you're out there marketing your country, you cannot just sit and say, yes, we have cattle. No, you have to say, these are the numbers of cattle we have, these are the age groups, these are the calves that they have every year, this is how long they can live. It's part of longevity. When you talk about birth certificate, and you can show that this cow has lived for 18 years, having a calf every year, surely that is a cow that another country would want to buy. That is a cow that, in fact, other countries like the US, they have semen from cattle and they sell it for a premium. So if you have a bull, you just sell the semen and say, this bull has cattle that are very healthy, that live for very long, they don't get diseases, and you get money.
What is laughable is that the reality of South Sudan is stuck compared to this rosy vision we are painting. We are trying to fix South Sudan so that we get into the next century and become like anyone else. But our situation is where we even get cattle raid, leave alone registering and knowing the cattle.
Well, the reason why they're being raided, apart from, that's a huge problem in terms of security. But what I was telling you about disease-free zones, if you have an electric fence around certain areas for cattle to be in, no one will come through those fenced area to come and get them. Number two, if we improve the health of our cattle so that somebody's cow is having a calf every single year, they will have so many cattle and they are more concentrating on selling those cattle than going to raid. But right now our cattle are not productive. You have a cow having a calf every 5 years. That's not a productive cow. It is not. So we need to improve the genetics and the productivity, but that is something that will happen eventually. Right now we need to talk about what is manageable.
If you have to speak to each and every governor in the nation, what do you think they should look out for in terms of the topic that we are talking about?
You're asking about large animals or small animals, because it's different. Okay, number one, I think we should look about diseases, the most dangerous diseases, to ensure that our livestock, our dogs, cats, and even cows, by the way, are vaccinated against these diseases that can affect human beings. Another thing is preventative care, to make sure that our cattle are dipped so that they don't fall ill to diseases that are transmitted by ticks and insects. Number three is this issue of, you're talking about registration, so that we can control the movement of animals. If you go rustling cows from town A and you get to town B, you should be stopped and asked where the paperwork for your cattle. If everybody has paperwork, that will reduce the incentive for people to steal and come and keep them in their homestead. So we should have even if it means having rangers visiting every household and say, yeah, these are your cattle, can we see the paperwork that shows that this is your cow?
When we speak about this idea of fixing South Sudan, is South Sudan fixable in your view?
I don't think that anything is beyond help. I think everything can be fixed. They say in English, where there's a will, there's a way. Our problem right now is that no one is doing their specific individual responsibility. Whenever we have a problem, the next thing we hear, oh, it's collective responsibility. It is not. There are certain people who've been given position, the platform, the power to do things, but they are not. As a country, we should be asking people in certain positions, what are you doing? What is your vision for your ministry? What do you think should be done with A, B, C, D? And this is how we go forward. If we know where we are, we know what we want to do, we will know how to get there. But if we just sit doing nothing, it will never go forward.
I want to ask you why you think the number of veterinary clinics in the country are not that many.
Yeah.
Is it that the vet doctors are not there, or what is the problem?
We have enough vet doctors, but what I said before, and it's something I'll always say, is that there's a lot of disincentive for people to practice veterinary medicine. Number one, as a ministry, we don't do the job. We derelict this duty to NGOs, right? NGOs do what they want to do because they have their own priorities. We don't delegate to them. We don't say this is what you can do and this is... There are other deals. Look at Niger, for example. They sat down with FAO and they said, you work with veterinarians. This is what you want to happen.
Food and agricultural
exactly. Niger did it, but if as South Sudan we don't say this is what we want, we'll never get it. We'll get those organizations, go and find people who are semi-literate, give them syringes and go and vaccinate. Today they get FMD. Tomorrow another organization says, oh, we have excess FMD vaccine. Let's go back to the same cattle, vaccinate them again. They're not involving doctors. They might come to me and say, oh, Dr. Aluel, can we have your CV to go and ask for a project from the European Union, for example? And I give them my CV. They'll never come back to me. Or they'll tell me, oh, I will pay you $300. Why pay me $300 if the European Union has brought $160 million to the country for a specific purpose? As South Sudanese, we need to put these things in front of them and say, no, this is not how you operate. We should give them the framework for operating. But no one will tell you these are your rights. You have to demand your rights. And this is how we'll... Yes.
Let's end on this note. Ebola outbreak is quite real and is around us in the Congo, and even as close as Uganda.
Yes.
And it's something that people are panicking about, but they don't know how to go about it. How do we protect ourselves from Ebola, which is a public health concern? It
is. The first thing we need to do is to educate ourselves on how do you actually get Ebola. Ebola is what we call a hemorrhagic virus. And the way it presents, the symptoms look like even malaria, because you start getting shivering, you get flu. But the people who are most at risk of catching Ebola are hunters. People who get this lamser, they go to the forest, they kill a monkey. They start preparing the flesh of the monkey. The bodily fluids from the monkey goes into them. They go have relations with their sexual partners. This is how it is spread. So from the hunter is usually patient zero. They're the ones who bring Ebola into the household. And then the woman goes and suckles the baby gets it. Someone dies, we go and wash it because we don't have mortuaries. The community has to deal with the dead body. If you're washing somebody who is bleeding from the nose, from the body, because of the Ebola virus, you're going to get it from touching the dead body.
Okay, the general public never gets to deal with that, but how do we protect ourselves?
Well, this is what I'm saying. We need to stop people from hunting monkeys.
Not just from the preventative side, but the fact that it is around the corner.
It's not.
And so what are we supposed to do to avoid it?
How can you avoid it like that? It's like asking me, how do I stop getting tuberculosis? I don't know. You will not get it from me.
Let's assume that there were cases of Ebola here.
Yeah.
Everyone starts avoiding greeting one another. Is that the way to do it?
I don't think so. This is the same panic that started when HIV first came into the market in the 80s. And people are like, no, you don't greet an HIV person. No, you see, the thing with viruses is they don't usually survive in the environment. If you put a virus on this table, it will die. It needs to be in a warm body. Yes, so I don't think stopping from greeting people is necessarily the problem. I just think if we have labs to test, in fact, we don't even know if we have Ebola because we don't have the diagnostic equipment for it. Let's have the diagnostic equipment for it. But let's not panic. This business of not greeting each other, it's a panic that is not called for, I don't think.
Thank you for coming to Fixing South Sudan.
Thank you very much.
Appreciate it.